Hi everyone, I'm Dr. Tash from Istanbul, Turkey. I'm going to talk about transperineal ultrasonography for pelvic floor dysfunctions in pregnancy. The primary aim of the study is to find a correlation between transperineal ultrasonography and pelvic floor dysfunction in pregnant women. Secondary outcomes of the study are to determine the risk factors for pelvic floor dysfunctions and to analyze any correlation between these risk factors and transperineal ultrasonography findings in pregnant women. Pelvic floor dysfunction consists of urinary incontinence, fecal or flatal incontinence, sexual dysfunction, pelvic pain, and pelvic organ prolapse. As you all know, pregnancy negatively affects the pelvic floor due to numerous hormonal changes and increased abdominal pressure. 49 women were enrolled in the study. It was designed in 3 parts. First, questionnaires, short form 36, pelvic floor distress inventory, incontinence impact questionnaire, female sexual function index were filled. Then pelvic floor muscle examination was done using modified Oxford scale and perfect sheen. Lastly, transperineal ultrasonography were performed. Bladder neck descent, pubovisceralis muscle thickness, detrusor muscle thickness, and hiatal area during rest, Valsalva and pelvic contraction were measured. Each was performed by a different clinician, blinded to the other data. Results. First, risk factors. Risk factors for stress urinary incontinence were found to be age, body mass index, gestational week, and birth weight. Sexual dysfunction were found in 71% of women, and 43% of women didn't engage in coitus at all during pregnancy. This high percentage shows us how it is important to inform the patients about this issue. Sexual dysfunction incidents were higher in older patients and also in the lower education group. Then, stress urinary incontinence and sexual dysfunction incidences were both negatively correlated with pelvic floor muscle strength. And lastly, the primary aim of the study, the correlation between transperineal ultrasonography and pelvic floor dysfunctions. Hiatal area measurements at rest, Valsalva, and pelvic contraction were found to be positively correlated with both stress urinary incontinence incidence and sexual dysfunction incidence. And detrusor muscle thickness is positively correlated with the urinary incontinence incidence. In conclusion, the patients may be embarrassed or think that it is normal and therefore don't complain about any pelvic floor dysfunction, but we should inform them and ask them specifically about these issues. Also, questionnaires may help us figure out the patient's problems and needs. Since transperineal ultrasonography is a safe, non-invasive, and effective method, maybe it can be used for pelvic floor dysfunctions in pregnancy as a screening method. After determining the high-risk patients with anamnesis, questionnaires, physical examination, and transperineal ultrasonography, we should inform and educate the patients and take preventive measures against pelvic floor dysfunctions. Take-home messages. Pelvic floor dysfunctions in pregnant women are common, so antenatal care should include addressing these problems. I hope you all at least consider to use transperineal ultrasonography for pelvic floor dysfunction screening in pregnant women. And I would like to thank you for your consideration.